PCOS or polycystic ovarian syndrome is a condition which is quite common nowadays. It's estimated about 15 to 20% of women at present suffer from polycystic ovarian syndrome. And it is a condition which is quite misunderstood, misdiagnosed, and sometimes overdiagnosed. Now, polycystic ovarian syndrome is actually a group of symptoms and signs that happen in a lady. There are three important things, two out of which, if present, we consider that the lady is affected by polycystic ovarian syndrome. Now, first thing is irregularity of menses. So, if a lady has irregularity of menses, especially delayed menses rather than early menses, it's called as oligoanovulation. It is either the egg is not forming at all or it is forming slightly late. These things tend to happen in women with polycystic ovaries. This is one of the important symptoms of PCOS. The second is hyperandrogenemia or hyperandrogenism. Now, how do we diagnose hyperandrogenism in women? This is a condition wherein there is higher male hormones in the lady, and because of high male hormones, the lady can manifest some signs and symptoms like excessive acne, or if there is hair growth on the upper lip or on the beard area or over the chest. Now, signs of hyperandrogenism, or if a blood test shows that there is high levels of male hormones in the person, then it is called as hyperandrogenism. The third important factor is on an ultrasound if we find polycystic ovaries. Now, polycystic ovaries, we have definite criteria to diagnose polycystic ovaries on scan, and if we find that the ovaries show features of polycystic nature, it's called as PCOM or polycystic ovarian morphology in the ovaries. Now, if two out of these three manifestations, that is irregularity of menses, hyperandrogenism, or presence of polycystic ovaries on scan, if two out of these three manifestations are present in a lady, we call it as polycystic ovarian syndrome. Now, how does it affect? It does affect the physical health, the emotional health, and the reproductive health in the lady. It can manifest, as I said, in the form of irregularity of menses leading to anovulation, that is lack of egg development, due to which the person may suffer from infertility. The other common manifestations can be prolonged period of lack of egg development can lead to abnormal uterine bleeding. That's another important symptom that can happen in women, especially in the absence of menses for 2 months, 3 months, or even longer duration. The lady may land up with menses which happens very unpredictably and can have prolonged bleeding, heavy bleeding, and other manifestations of abnormality in bleeding. The third important manifestation are metabolic features. PCOS women tend to be at risk of developing type 2 diabetes and also gestational diabetes. That is, when they eventually get pregnant, there's a higher risk of developing diabetes. And going on later, outside reproduction, women as they age may also be at risk of developing type 2 diabetes mellitus, which is an important metabolic manifestation of polycystic ovary. PCOS women are also known to be at higher risk of hypertension and cardiovascular disease. These are all the effects of this disorder, which is an important disorder which leads to hormone disturbances, which eventually leads to other manifestations. This is a very common misunderstanding among women. They tend to use it interchangeably, ovarian cyst and polycystic ovaries. It's very important to know that polycystic ovary is actually a misnomer. It's not an ovary with cysts, but it's an ovary with multiple follicles, that is large number of eggs. The condition of polycystic ovary, the impairment ovulation is such that the ovary has a lot of follicles in them. In a regular normal ovary, we tend to have about 8 to 12 follicles in them on an ultrasound. But if we see that the lady has like 25-30 follicles in the ovary, this we call it as polycystic ovarian morphology for the ovary. Now, if there are a lot of eggs in the ovary, then ovulation is impaired. This is called as polycystic ovary. The cyst word in polycystic ovary is a misnomer. We have to keep that in mind. They are actually follicles. Now, ovarian cyst is a condition which is usually acute and random, or I can say once in a while every lady forms an ovarian cyst. These are cysts which incidentally develop in women, either because of non-resolution of a corpus luteum of the previous egg, or because of an egg which did not release in the previous cycle. These are nothing but residual follicles of the previous menses which can retain in the next cycle. These are called as follicular cysts. And all that they can cause is a slight irregularity of menses, and usually they are benign and should not have any major impact on the lady. However, here I am not touching upon endometriotic cysts, which are completely different cysts, wherein the endometrial lining tends to deposit on the ovary and form a cyst, which is called as endometriotic cyst. It's a totally different condition. However, in general, when doctors say ovarian cyst, they mean follicular cyst most often, unless they tell it has endometriotic cyst. So we need to understand that ovarian cyst is a different condition compared to a polycystic ovarian syndrome. Insulin resistance is a very common manifestation in women with polycystic ovaries. Insulin resistance seems to be present almost in 70 to 80% of women with this condition. It's a condition wherein the body cells are less responsive to insulin, as a result of which the pancreas, that's the organ that forms the insulin, tends to produce more and more insulin. So the lady with polycystic ovaries tends to have a higher level of insulin in her body, which indirectly leads to insulin resistance and also eventually leading to gestational diabetes, that is diabetes in pregnancy, and also type 2 diabetes eventually. Now, how does insulin resistance manifest, or what are the other characteristics of this condition? Usually women with polycystic ovaries and insulin resistance are known to be obese or easily put on weight. They also have some patches on their skin which is called as acanthosis nigricans, which is nothing but dark patches of skin around the neck or other creases in the body. Insulin resistance can also manifest in a way of craving for carbohydrates and a resistance to weight loss in spite of all efforts. So the management for insulin resistance and polycystic ovaries would be essentially good diet, a good exercise plan, and if necessary, there are some medications called as insulin sensitizers like metformin, which helps in actually improving insulin resistance and can help not only in controlling the insulin levels but also sugar levels if the sugars are borderline. The clinical manifestations in a lady with polycystic ovarian syndrome would include the most important and the hallmark is abnormal uterine bleeding. That means irregularity of menses. Now, this irregularity can vary from a little bit of irregularity, that is a 30-day cycle becoming a 35-day cycle, to a condition wherein women may not get menses without medications. So there are times when a lady may go on for a year without menses. Now, all these are manifestations of severe form of polycystic ovarian syndrome, wherein ovaries have plenty of eggs but none of them are maturing or releasing. Now, irregularity of menses when left untreated over a prolonged period of time can lead to a condition of the endometrial lining called as endometrial hypoplasia or eventually endometrial cancer. These risks do not come in for a short duration of time. However, neglected abnormal bleeding over years of duration, say for a decade or so, can eventually lead to endometrial conditions. So it's important that when women suffer from these irregularity of cycle, they seek out treatment and manage it correctly. The second important manifestation of polycystic ovarian syndrome is hirsutism. Hirsutism is nothing but a condition that manifests due to high androgen levels in the women. Androgens means male hormones. So if there are increased male hormones in women, then this leads to manifestation of excessive acne, male pattern baldness, thinning of hair, excessive hair on the upper lip, on the chin area, on the chest area. So all manifestations of men happening in women happen because of higher male hormones. So this is an important effect of polycystic ovarian syndrome. Not everybody develops it, but there is a subset of women who tend to manifest these symptoms. And when they have it, there are answers, there are medications, there are procedures that can help to overcome this. The third important factor is about insulin resistance. That is wherein the cells of the body become resistant to insulin, due to which the pancreas tend to secrete more insulin. So there is hyperinsulinemia, which in turn leads to hyperglycemia, that is high sugars in the body, making the lady more prone for diabetes in later life. Other symptoms of polycystic ovaries are weight gain or difficulty in loss of weight. There is a slight resistance to weight loss in polycystic ovarian syndrome, so the effort for weight loss can be slightly higher in them. So it's important that when such a manifestation happens, to check insulin levels and see if there are medications that could help this. The other manifestations of polycystic ovaries can be some skin changes, especially hyperinsulinemia and insulin resistance leads to a condition called as acanthosis nigricans, which involves formation of black patches around the neck and around other creases in the body. The last and the most important side effect or manifestation of polycystic ovaries is infertility, and this is secondary to anovulation, that is irregularity of menses, which happens because of lack of egg development, actually results in infertility because there's no egg development. This is usually treatable easily in the form of management of weight, taking some ovulation induction medications, and once ovulation is corrected, the chances of pregnancy also is quite high. So it's important that if a lady desires fertility and there is irregular menses due to polycystic ovaries, she should seek out help with a healthcare provider to correct it.